thank you very much indeed for that introduction. And it's a real pleasure to be here, not least because Charlie can demonstrate that if you buy me dinner and take me to a beautiful place like this, I'll probably agree to anything. And here we are. So without any further ado, we're going to talk about artists with epilepsy rather than art depicting people with epilepsy, and talk about the kind of creative sparks, the people behind it. So look, I know that you've given up a beautiful evening at Oxford tonight, and it is a really pretty city, and it's prettier than Newcastle, which has this post-industrial charm. And I've sort of grown to love Newcastle since I've been up there in August, because I've spent time elsewhere in the world, sort of understanding a bit about other healthcare systems and a bit about how the rest of the world works when it's under-resourced. I'm talking specifically about Cardiff on Saturday night. And we're hoping that in time we might be able to bring the riches of the world to Cardiff. But until then, I've learnt to live in England. Epilepsy, right. So there's something very verbal about the way that people describe what happens to them with an epileptic seizure. Because by the time they come into your clinic room, it's already stopped. So unlike somebody who comes in with visual problems and you can test it, or a memory problem, you can test it, they're telling you about something that has happened, and they may not be the best person to tell you what has happened because they may have had a blackout or a memory problem, or they might have been in and out of consciousness. So there's a couple of inconsistencies with this kind of verbal diagnosis, not least that we're having a session about the visual arts and this verbal disorder. And I guess the reason why we're talking about it is that if you presented with Alzheimer's or a dementia, you might be presenting with a lack of memory, a lack of confidence, a lack of a change in yourself and your identity and who you are as a person. Or if you present following a stroke, you might be presenting with problems with moving and problems with feeling and problems with getting around. But with epilepsy, you get additional things. There's something about the epileptic seizure which can give you perception or phenomena that weren't really there. A strange memory tic, such as déjà vu, that strange potent emotional feeling of I've been here before and I know what's going to happen next, or what they call an ecstatic aura, that really pleasurable feeling. I've got a patient whose epilepsy just wasn't obvious for the first 8 years that he was presenting. And he had this ecstatic aura, this joyous feeling. He thought God was speaking to him. He was going to join the priesthood until he had a full-blown convulsion, and then that terrible feeling of realizing this is epilepsy. You also have these visual, smell, or hearing hallucinations or illusions. So I guess that's why people have always wondered, do people who have epilepsy, can they use these additional phenomena to help inspire them? Is there something that epilepsy can give you to be a great artist? And there's a long history of looking at neurological disease and how it might affect visual arts. These are Wellington Cooning's pictures going through he had a series of blues and nudes going from Marilyn Monroe here right up to 1950 to 1980. He developed Alzheimer's dementia, and you can sort of imagine the transition of these paintings, how they get a bit more fragmentary, deconstructed, more elemental, there's less use of colour, and it's really a description of how somebody in themselves, the fragments of their lives are changing, his art is changing. Or in a less dramatic way, you've got Degas, who, this is one of his pictures from about 1880s, I think, with good eyesight, and given 20, 30 years, his eyesight's failing really quite poorly, and his brushwork depicting his failing eyesight has changed quite dramatically as well. And there are examples about some that are a bit apocryphal, like Lowry's astigmatism and other people's neurological disorders changing their art, but you wonder whether epilepsy can impact on people's pictures too. So, the first is a warning to me, and that's about the perils of going back in time and trying to make a retrospective diagnosis. It's really intoxicating. You go back and go, oh, they had porphyria, oh, they had epilepsy. And it's really easy because it's really hard to disprove that you were incorrect, or disprove that you were correct. Right, so I'm indebted to this paper from John Hughes from Chicago, who went back at some of them and looked at some of the more dubious claims. Did all these famous people really have epilepsy? And it's an interesting paper just going through bit by bit and sort of weeding out some of these false claims from the literature. So it's not meant to be an eyesight test, but we've got some people from back in BC era, Pythagoras, Aristotle, Hannibal, had no episodes whatsoever. This is just apocryphal. Then most of the other people in the Renaissance, they've probably got a diagnosis of epilepsy because they were either erratic characters or they had other episodes that came and went that might have been kidney stones, or it might have been gout, or it might have been psychological changes. Right up into 1700s and 1800s, you're beginning to get some sort of psychological attacks. We've got Shelley here with fits of pain, and Byron with psychogenics of mood-based attacks. And going right into the more modern era, we've got Richard Burton bottom here, which probably had seizures, but they were probably alcohol withdrawal seizures rather than a true epilepsy. So I think we can weed out some of these people from the pantheon of epilepsy geniuses. But if you forgive me, I'm going to include Van Gogh. And I know it's a little bit tenuous because lots of people have gone back and thought, what was his illness? But if epilepsy was the diagnosis in his lifetime, I still think it's fair to include him. And this is one of his paintings of Dr. Gachet, his physician. It's an interesting one to include because Gachet is cradling foxglove, digitalis, which was used to try and treat Van Gogh's epilepsy in his lifetime. And those of you who are medical might know that digitalis toxicity makes your vision go yellow, this xanthopsia, and he paints with these most exquisite hues, a palette unlike anybody who came before him. Now, I do think it's a little bit too far to extrapolate that, but it's interesting, because when you go back through, I think the epilepsy diagnosis is hard to settle on, because his diary excerpts that people use say, well, these are seizures, really just describe a man in a maelstrom of emotion and relationship traumas, and it really speaks more of a psychological, psychiatric illness than a true neurological illness. And certainly absinthe was part of the problem rather than part of the solution. Self-medicating with the green fairy, this elixir probably did not help his mental or physical health. So the next case. Next case is somebody who we really do think has epilepsy, and I think he tells us the story of perhaps succeeding despite the odds, or at least rolling with the punches. So he's Sir John Kiffin Williams, Welshman from northwest Wales, from Anglesey, part of the empire not conquered by the Romans. And proud North Walian people, they're slightly different, you see. And he paints these really bleak 20th century, typically Welsh post-industrial landscapes in a very limited palette. And there's this comment from his autobiography, from his biography, talking about just how he wouldn't necessarily be inspired by the mishaps, but just work them in. So he was only too happy for an oil he was painting to be inadvertently toppled, and while it's toppling end face down on a new hat, or for the texture of a watercolour, if he's tackling al fresco on the windy shore of San Vern, to be helped along by the addition of windblown sand. He'd just work it in to what he was doing, and further on it goes to describe that if he had a seizure and knocks the canvas over, he wasn't inspired by it, he wasn't hoping to do it, but he wouldn't trash it either, and he'd pick it back up and he'd rework it and keep going. And I think that really just shows the spirit of the man, because the works describing his life story are quite interesting. So he joins the army as a young man without much of a direction. He starts having his first seizures in bed before he gets his commission. He wakes up and he's in a daze, his tongue is macerated, he doesn't know what's happened to him. And after a couple of these, he goes to see a neurologist called Sir Hugh Cairns, who gives him one of the earliest EEGs. And he describes the kind of mechanical hand drawing the EEG. And after a week of tests, they put him on a medication called luminol and something called Irish moss. I don't really know what it is, but it might be Irish and it might be moss. And he says it's disgusting. And the doctor comes in, who may or may not be Sir Hugh, and says, look, when are you going to leave the army? You're clearly abnormal. Which I don't know whether that was akin to the communication style at the time, but it was stark, and he knew where he stood, so he left the army. And he took up painting as a form of occupational therapy and a way to get out into the fresh air, as was sort of the custom at the time, particularly if you weren't overburdened by the problems with poverty, to actually get out and see some of the real world. He didn't let the fact that he was ineligible to drive at the stage, there was a total ban on people with epilepsy driving, hold him back. He'd hire a chauffeur and go around North Wales. And then furthermore, in his autobiography, he describes actually driving sometimes, often as far as Italy, which I think is sort of bending the driving rules to the point of braking, but it didn't hold him back. And he also had this kind of innate Celtic melancholia. There's this kind of feeling that not only should he be one with the darkness because he comes from northwest Wales, but also because he has epilepsy. So it allows him to have a sense of understanding of self that this would be normal for him. This kind of the gloomy, morbid mood would be in keeping with both his art and his identity as a Welshman and his epilepsy. So in contrast to Kiffin, who sort of gains an acceptance of his seizures, is Edward Lear, who wanted absolutely nothing to do with his epilepsy. And he accounts in his diary excerpts and in letters to his sister how wonderful it is that these fits have never been discovered. And he describes it as a demon, and he has a little code in his diary for his seizures and when they occur, desperately not wanting other people to identify with this. And I'm sympathetic to Edward Lear. He was one of 20, I think he was the 20th of 20, and he had an older sister who died of an epilepsy-associated death prematurely, and that certainly would have changed the way that he felt about epilepsy and wanting to hide it from the outside world. And so it's really difficult to try and say that epilepsy in any way, shape or form changed the way that he draws these beautiful pictures of macaws and owls. And you could say that maybe it inspires him in terms of his nonsense verse. There was an old man with a beard who said, "It is just as I feared. Two owls and a hen, 4 larks and a wren have all built their nests in my beard." But actually, I think it's just a distraction. There's nothing about epilepsy that you can speak to his nonsense verse. He, like Kiffin, suffered from low mood, depression, what he called the morbids. Similar to Kiffin, because he was an Englishman of a certain class, he could be a traveller and see the world. He took up painting in a way similar to Kiffin as occupational therapy, but it's certainly not an influence on the art that he's left behind. So if there's a theme between Kiffin, Williams and Lear, it might be something to do with their mental health, and you can extrapolate that further with Charles Altamont Doyle, better known as Arthur Conan Doyle's father, and he helped do the illustrations for the first Sherlock Holmes novel, A Study in Scarlet. I don't really know when his epilepsy began, but it certainly was a feature of his last 10, 15 years of his life, and it certainly was denoted as the cause of death in his death certificate. And he had an unhealthy relationship with alcohol, and in the 1880s, I think he was admitted to an asylum. And in many ways, his art flourished within the rigour and the structure of the asylum. But the content, he did lots of self-portrait, but the content of the pieces became a lot more macabre, a lot more dark, bleak, more spiritualist and demon elements within it. And there's a kind of descent into at least, I can't say, a descent into at least the darker themes within his work over this period. He then blossomed, and he spent a long time being a prolific artist trying to use art to demonstrate his sanity. Could a sound mind be producing images as beautiful as this? And yet I find there's a little juxtaposition in amongst the fact that the focus of his art is creating these fantastical characters, these fairies, and these otherworldly characters as a way of trying to demonstrate his sanity. So these are historical artists who had to battle against epilepsy in the era before we had adequate treatment, when there was lots of stigma, when the opportunities were reduced to you, and there must have been lots more people with epilepsy who were artistic and we don't know what they left behind. But we have the opportunity to look at modern day artists and see what they paint and see what might have inspired them. And I've got the example of 2 people who I've seen in clinic. He's a young man, he's at transition, he's moving into adult epilepsy clinic, coping with college, coping with sleep, coping with sexuality, coping with these kinds of issues. He's also coping with a drug change and changing his medicine from one to the other, and it sort of destabilises medicine a bit. And he paints this. So this is a convulsion. This is an old-fashioned grand mal seizure to him. It's a self-portrait. He's this android kind of figure here at the centre. It's angular. The palette is shifted towards moody colours. It's a mixed materials piece with oils and acrylic, and within it you can see bursts of electricity. It's coarse, it's ugly, it's angular, and primitive is the word that he uses to describe it. And it depicts a period of time where I've destabilised him. So I'm moving him from one drug to another, hopefully trying to better control his epilepsy. But in doing so, I've either unmasked or provoked, or maybe the social circumstances have tickled up too, feelings of panic and anxiety, and he paints it. But it's not the only type of seizure he has. He also has little blank spells. So these are little staring moments where he'll just disappear. And in many ways, they feel more disabling to him because he is more aware of this loss. A 10, 15 second punchy absence, a loss of awareness. And this is a wood carving that he uses to describe this. And I'll read you a little bit about the words that he used to describe it to me. So he went to pains to say the fact that this uses different materials is just that he's an experimenter. There's nothing specifically about this being a wood carving that speaks to this type of seizure. And although he is painting his seizures, it's not the only thing he paints. It's just something he's tried to do. So it's not the sole focus of his work. He says that following a seizure, he's more irritable. His patience isn't as good. He's more likely to get frustrated and upset with a bit of art that's not quite working for him, and he might be more likely to abandon it. And here he says, I was receiving medication, and I was under the impression that these absences and these seizures would stop. That was part of the contract of trying to change the medicine to try and make him better. And he said, well, they didn't, and he felt very isolated and very confused. And this piece really shows that isolation, and it's small, it's tight, it's a small piece of work, and it really just shows the world becoming smaller around him. So I said there'd be another artist that I'd draw upon, and Tracy's art is slightly different. And she has been inspired by not just her seizures, but what triggers her seizures to create her art. And I'm going to read her description of entering a wood or a forest. She describes how it needs to be a gradual process. So she says, first passing the thinner trees with the odd thick trunk interspersed amongst them until in measures I find myself in a wooded area populated by mature trees with thick long trunks. And by transition I enter. Now the vertical trunks of varying thicknesses, the backdrop of dappled light and the verdant green are all subject to the laws of depth of field. And a horizontal web of lower branches weaves its way amongst the trunks and interrupts the backdrop. And the visual display is a complex array of lines, the bolder being the vertical trunks. A really visual and emotional way of entering a forest, and this is why she starts to have her epileptic seizures in this state. And why is it? She has a reflex epilepsy. Her seizures are caused by environmental stimuli, by the world around her. Now we're familiar with flashing lights and the warnings that people might be given before the news when there's flash photography, but for her, she's got a number of triggers, and some are very quite potent. One is contrasting pattern, dark and lights of patterns, and the other is a kind of a feeling of depth of field. So for her, scale drawings and scaling things up, there's something about that depth that really is a potent trigger for her seizures, and she describes this here. So she says, it's often in the mature wood that I begin to feel the effects of the epilepsy. I'm a little off balance and nauseous, and there's a stirring sensation in my lower abdomen. The initial sharp intakes of breath that accompany the jerks first occur within my head, and then these jerks progress, and I felt more strongly. The colours are vibrant, as if backlit, as if a computer monitor is backlit, and she's having little jumps and jerks that she can certainly feel, maybe we can see too, within this type of environment. So she paints them, and she paints them flat. She paints them really flat with no depth of field, and she paints them in such a way to try and limit the ability for this pattern to cause her seizures, but it still has to be emotionally reminiscent of the trigger. So she can now have the beauty of the forest without it triggering an attack with this kind of flat, stylized version of wandering into that wood. And again, I'm going to read a description of how she goes about doing this. So for her, she needs to keep the vivacious and vivid nature of the trigger. It was all about how loose it is, how vibrant it is, and she put the paint straight onto the canvas to try and get these primary colours, to get this feeling of colour and contrast. And then she says there have been times during the painting, usually when she's blocking it out, and there are vertical trunks that are apparent against the background colour, which leads to jerks. So she'll still have the jumps and jerks while she's painting, and these can cause the trunks perhaps to move as she's painting them. And then she says, work at this stage must stop. And then these rest breaks can normally cease, usually when the vertical lines are broken up with some of these cross-cutting branches that she's drawn here and the overlapping leaves. So she leaves it in a way, probably with the minimum done, so it no longer is a potent trigger for her seizures. So why else might people depict epilepsy or be inspired by it? And sometimes it's to tell an important story. So this is a little cheat because the author or the artist here doesn't have epilepsy themselves, but his brother does. And it's a graphic novel in French, David Bay. In English, they call it epileptic, which is a word that has a bit of a stigma associated with it. It's not a word that people would normally use. You might say somebody with epilepsy rather than I am epileptic. And in French, they called it l'ascension du mal, which I think would translate well as the rising evil, I guess. So epileptic has that stigma associated with it. And the imagery is beautiful all throughout. So this is his brother. And his brother is in the grips of a seizure here, and he's fighting a dragon. And the dragon's invisible, the dragon's a metaphor, but here he is being overwhelmed by this dragon too. He's not just fighting it off, he's losing this battle. And the depiction at the top says, this one is horrendous. The convulsions go on, they twist him into knots. And there's great imagery here about when he fights and succeeds. He's a ninja warrior in kind of samurai dress, or there's the impact of epilepsy amongst the family. So this is one of the more stark images from the graphic novel. This is the brother. They've shaved his head, and in the text at the top it says, in her mind, talking about his mum, this sends us all the way back to square one, talking about a change of medicine here, talking about a change of status. She has a vision of her son back in the hospital, his head shaved, and it's as if she's been pulled backwards. And so this is the dragon all throughout the graphic novel. It stalks him, it's waiting, it's there, it's the threat of another seizure. Up here we have the technologists in the white coats and the other doctors sort of peering on, just observing him. I think the cables and the machinery across the top here are probably the tests and the EEG and the wires, and it's the over-medicalization of David. And that's probably me. That's probably the neurologist with the beetle-furrowed brow and his hands in his pockets with the detachment here and a little sneer. That's probably the neurologist. And there are great scenes throughout the book when they talk about stigma, and they talk about how having somebody with a severe epilepsy within the whole family changes the family dynamic. So there's the protagonist whose eyes we see the story, there's the brother with epilepsy, and there's the sister. And there's that feeling that they all have a battle against the epilepsy because it might come to them, and they've got to fight it off. And the feeling if they give into it, maybe the unaffected sister might be more likely to succumb, and then the survivor's guilt when they don't go on to get the epilepsy. It's really quite an interesting read. So, there are many people who have tried to put together essays and treatises about the genius associated with epilepsy, and although many people have succeeded, some have done so despite their epilepsy rather than necessarily being inspired by it. And some of the imagery they've put together has been bleak and it's dark, and it may be that some of the comorbidities have been more likely to inspire the depression or the stigma or the isolation than the actual seizures themselves. Some of this may be historic, and I think in the era where people are well treated, both with medicine and well treated by society, we might get a breakthrough on a different horizon in terms of the visual art that people are creating. And I think I have to reflect and say there is a degree of genius here, so I'm not trying to remove this from the epilepsy art world, but the genius may be in surviving like Kyffin Williams did and rolling with the punches and being a success alongside your epilepsy rather than being inspired by or succeeding despite. Some of this comes from an article that we put together what feels like a short time ago but must have been a long time ago, and I'll be very happy to take your questions.